Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
All right, let's dive in. Today we're tackling gout, and we're focusing on this just for you. You sent us some really interesting stuff from Alberta Rheumatology, 3 YouTube videos, and their website.
Oh, excellent.
Yeah, so we're going to break it all down.
That's good.
Now, when you think gout, you think, what? Like kings and fancy feasts.
Yeah, the good life, right? Haha.
Exactly. But honestly, it's a lot more common than people realize, and the science behind it's actually pretty fascinating. Like those videos we got, they don't sugarcoat it. Patients describe the pain as shards of glass in their joints. Yikes. And that's those uric acid crystals making their presence known.
Oh, I can only imagine.
And the worst part is, it hits you like that. 1 minute your big toe is A, okay, the next, bam, your sideline.
It really is like this sudden internal storm. Right?
Yeah.
That intense, immediate pain. That's your immune system basically freaking out. But not the way it's supposed to.
Okay. So how does that even work?
So uric acid, it's a natural byproduct. We all have it. But have too much floating around. Problem. It forms these, well, tiny, jagged crystals. And they seem to love hanging out in the cooler parts of our bodies, like our joints.
Oh, no, not good. So wait, it's not like an infection or an injury. It's my own body attacking itself.
You got it. Your immune system sees those crystals, thinks intruder alert, and launches a full-on assault.
Yeah.
Flooding the area with all this inflammatory stuff.
Yeah.
And that's what causes the agony and the swelling.
So you're basically caught in the crossfire. That's rough. But hey, at least knowing the why makes it a little less scary, right?
I think so, yeah. Knowledge is power.
Absolutely. And speaking of knowledge, let's look at what ups your chances of ending up in gout territory. The website, it's got this super detailed list of risk factors. And surprise, surprise, it's not all about what you eat. Age is a factor. Men are more likely to get it, especially as they, get older. Family history plays a role, too. And then you've got things like kidney disease, even some medications.
Oh, that's right. They mentioned that.
Yeah, like diuretics or even low-dose aspirin, which I was like, really?
Yeah, it's surprising.
It really is. And while we do often hear about diet and gout,
Right.
It's not as simple as just ditching all the good stuff. It can trigger flare-ups for some, for sure, but it's more about finding what sets you off, not just banning all rich foods.
Totally. What I find fascinating is how everything's connected. Low-dose aspirin, good for the heart, potentially bad news for gout.
Right.
It just goes to show why it's so important to loop your doctor in on everything, your history, medications, even the over-the-counter stuff.
Couldn't agree more. It's about getting the full picture, not just slapping a Band-Aid on the symptoms. Speaking of which, the videos talk about diagnosis, and here's a curveball, blood tests aren't always the answer. You'd think they'd be the gold standard, right?
Yeah, for sure.
But apparently you can have high uric acid and no gout, or your levels might be normal during a flare-up.
Wild, isn't it?
It is. They say the most reliable way to diagnose is by going straight to the source, looking for those crystals in the fluid from the joint.
Ah, so it's like a detective case. You got to find the actual evidence.
Exactly. And speaking of getting specific, the videos do a great job of explaining the difference between gout and something called pseudo-gout.
Right, easy to mix those up.
Totally. Feels very similar, but it's a different culprit. Calcium pyrophosphate crystals instead of uric acid. Same painful party, different guest list.
Exactly. And that difference is huge when it comes to treatment, especially figuring out how to prevent those future episodes. And that's where it gets really interesting, right? Figuring out how to tackle it.
Yeah, because once those crystals have settled in, you want them out ASP. So what's the eviction process look like?
Well, the videos do a good job of explaining it. Basically, there's dealing with the flare-up right now, and there's a long game trying to stop them from coming back.
Okay, so like a two-pronged attack plan. Put out the fire, then figure out how to fireproof the place.
Exactly. For those acute attacks, they talk about a few key things. NSAIDs, colchicine, and cortisone shots.
All right, let's unpack those a bit. What are we working with here?
So NSAIDs, those are your over-the-counter pain relievers like ibuprofen or naproxen. They can help with the pain and inflammation, at least in the short term.
Makes sense. And colchicine?
That's another anti-inflammatory, specifically for gout. You can be really effective, but it tends to come with more side effects, unfortunately.
Gotta weigh the pros and cons there. And then we have the cortisone injections. Those seem to be a bit of a game changer, at least from what they show in the videos. What makes them so good for gout specifically?
It's all about targeted relief. Cortisone, it's a powerful anti-inflammatory, and when you inject it right into the problem area, the joint, man, it can really knock that pain out quickly.
That sounds like a godsend when you're in that much pain. But as you said, long term, it's about getting that uric acid under control, right?
Absolutely. And that's where those preventative meds come in. They spend a lot of time talking about allopurinol. It's kind of the MVP for preventing those future gout attacks.
Okay, so allopurinol, tell me more. How does it actually work to lower uric acid?
It's like, imagine allopurinol as this little housekeeper in your body.
Yeah.
Yeah. It basically slows down how much uric acid you're making, which gives your system a chance to catch up and clear out the excess. Stops those crystals from forming in the first place.
So it's tidying up, keeping things in check day in, day out. I like that. Makes it much easier to picture. But even with medication, are there things people can do, lifestyle-wise, to help manage their gout? It can't be all about pills, right? You're totally right. It's got to be about more than just popping pills. The videos and the website, they both talk about lifestyle stuff, and I'm really curious about that. What can people actually do to get ahead of this thing?
Well, diet's a big one, but it's not always what you think. It's not about saying goodbye to all the good stuff. It's more about paying attention to what your personal triggers are.
Okay, so less about deprivation, more about knowing your body.
Exactly. And you know what's interesting? The videos mention some research on vitamin C.
Really?
Yeah, apparently it might actually help lower uric acid. Kind of surprising, right?
That is. So, like, more citrus fruits, squeezing lemon in your water, that kind of thing.
It's worth looking into, for sure. Talk to your doctor, see what they think. And I think that's the big takeaway here, really.
What's that?
It's all about finding what works for you. And a lot of times that means teaming up with your doctor.
Makes sense. Having that personalized game plan. You come with the info, they help you apply it.
Exactly. A true partnership.
You know, one thing that really stood out to me in all this, it wasn't just about gout itself. They were talking about high uric acid being linked to other things too. Kidney stones, even heart problems.
It's true. It's like gout's not always the whole story. It can be a sign of something bigger going on.
So really taking care of your gout, it's about your whole health picture.
Absolutely.
Well, to our listener out there, thanks for taking this deep dive with us. We hope you walked away feeling empowered, like you've got some ammo to talk to your doctor and really advocate for yourself.
Couldn't have said it better myself.
Because, hey, when it comes to your health, knowledge, that's power.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upas, technical producer, John Ifan, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.